And I too would like to pass along condolences and sympathies to the family. The deceased is a woman in her 80s in Cape Breton, and like all the other deaths, that is the level of information that we will provide publicly. Again, it is tragic, and it really points out the serious nature of this virus. And again, to the family, certainly dealing with a death at any time is hard, but especially at a time in COVID where we're asking families not to be together. So my sympathies again to them. In terms of our regular case update, we're announcing 27 new cases of COVID-19, which brings us to a total of confirmed cases in Nova Scotia to 606. Currently, we have 11 individuals in hospital. 5 of those are in the ICU. We have 177 people now who can be considered to be recovered from their COVID-19 infection. We have tested 19,506 Nova Scotians and who have come back negative. And in the last 24 hours, yet again, our lab, outstanding work, they processed 966 tests. As I mentioned yesterday, we started reporting the number of cases of COVID-19 in our licensed long-term care homes. I was incorrect yesterday when I said they're from all of continuing care. I was reading my notes wrong. My apologies on that, but the numbers we report are from long-term care only. And we're still refining that process. Some of the numbers coming in from facilities change over time. So if people are seeing some inconsistencies as we refine this process, we apologize for that. But there's also time lags and reporting from different agencies as well. But as of today, we now have 8 licensed facilities, long-term care facilities with COVID-19, being identified in them, and that involves in total 55 residents and 43 staff. We continue to support all our long-term care facilities, and especially those that may be in outbreak situations. As we close another week now into mid-April, I just want to take a couple of minutes to look back of our collective journey. Unfortunately, we're doing it, but our collective journey with this virus, unwanted as it is. As a province and a healthcare system, we have been monitoring and preparing for COVID-19 since January. That's when we began to have, in public health, regular phone calls of chief MOHs across the country and our federal colleagues understanding what was happening first in China. We began asking international travelers to self-isolate as they came into our province in early February, and we, as the virus evolved, spread beyond China, we evolved our screening protocols to match that international situation as well. It was March 15th that Nova Scotia confirmed its first case of COVID-19. We had the fortune, I guess, of being the last province with in the country that had a confirmed case. We're lucky in that. It meant that we could learn from our other provinces who were earlier on in this. It also meant that we were able to implement the strong measures to shut things down much earlier in our outbreak, if you will, here in this province, as opposed to some other provinces. So we closed bars and restaurants, put limits on gathering, asked people to stay home at a point when we had less than 10 cases in the province. So we're seeing some of the benefits of that early action as we this week, as we presented some of the modeling where we're tracking in a place below what the modeling would project we may be. We've continued to work to make major shifts in our healthcare system and our education systems to ensure people, as much as possible, are being kept safe. We're keeping people at home as much as possible, but still having the necessary access to virtual learning and to, in many ways, into healthcare. Often that's virtual as well for people. March 22nd, we could declare a state of emergency, and we enhanced, necessarily so, the restrictions that we put on everybody's day-to-day lives. As we've done this, our testing capabilities and our approaches by public health in terms of case contact and follow-up have evolved. We are now, as I said earlier this week, we're second in the country, just behind Alberta, in terms of per capita testing, and that's very important. All the evidence says that aggressive, wide testing is a key component of getting ahead of this disease. And what needs to happen to that, and what we're doing is then that testing is combined with strong public health measures by the public, as well as aggressive and timely follow-up of cases and their close contacts by public health, which is exactly what we're doing. I do want to give a shout out to my public health colleagues. They are close to my heart. I worked with them for 20 years. Often public health goes unrecognized. I know they're stretched right now to all the work, and people are working very long days. They're not seen, but they're doing tremendous work, and I thank all of my public health colleagues for that. We are in a situation, as we presented with our modeling, that while the virus continues to grow, we're in a situation where we're able to handle that. Our health system is not being overwhelmed, and if we can keep doing the things that we're doing, we should be able to stay within that situation. But it's only that really is a result of the efforts that every Nova Scotian has done to allow us to be in that place. I fully acknowledge how difficult it is for people, for families. We put a lot of restrictions on people. Businesses, families are all feeling the impact of this, and I want to thank everybody for doing this. But we just need to point to the fact that we're doing this to ultimately together to save lives. Unfortunately, we've had 4 Nova Scotians who have died. We have several others who are in intensive care units. But I hope everybody can understand that the sacrifices we're all making is helping other Nova Scotians to be alive today, other Nova Scotians from not having to become severely ill and perhaps be in an intensive care unit. We are supporting each other by doing what we're doing. We do need to recognize that we're not out of this yet. We have some weeks of this to come that we need to maintain our strong approaches. But I hope as I talked about last week, there are ways that we are perhaps changing. We're becoming different, but there may be opportunities within all of that. We've found new ways in our communities to support one another, new ways within our families. And so while we're in the middle of some of these difficult situations, we have to recognize that we are being able to avoid some of the more severe challenges that if you look in either other provinces and certainly in other countries, and so I think we need to step back for a minute and look at each other and say thank you to each other, because it's because of the burdens we've been willing to take on and the ways we've been able to support each other even through this, that we're able to, and continuing to do this in the next few weeks, is what's going to allow us to come out of this with minimizing the impact on the health impacts from this. It's also what will allow us to get out of this as soon as possible. So I'll end up by saying, again, repeating my thanks to everybody. Appreciate that as the days and weeks go on, that what may have, that this becomes even more challenging as we move into our 5th and 6th week and have 6 weeks and have a few more weeks ahead. But again, if we can all stick with this together, we're supporting each other, minimizing the impacts on our communities, and it will allow us to get out of this as soon as we can. I'm starting to turn my mind. I've had discussions within public health. What are the things we start to do in the next few weeks that we can start to plan out how we might be able to loosen things up, and if we're successful, and in somewhat with luck, but also some of this is in all of our hands. If we all stick with what we need to do for the next few weeks, we're potentially in a position. We're coming into May and into June. We can start to loosen things up slowly and progressively. But we want to be able to do that. And as we get into summer, hopefully we can start to have a bit of more of a normal life as we move into summer weather. But again, I'll just end up by saying thank you to everything that Nova Scotians have given up. Thank you for your sacrifices. It's not unrecognized, but I ask people to stick with us for the next few weeks. Let's stick together, and we will come out of this as I said last week, different. But there may be ways we can come out of this better.